Greetings, everyone, and welcome to Healthcare Market Matrix. I'm your host, John Farkas, and joining me in the Ratio Studios is Mitch Holdwick. And Mitch and I are going to spend some time today exploring the realm of consumer engagement in healthcare. And Mitch comes at that honestly. He spent more than 14 years with healthcare marketing focus and CRM and consumer engagement strategies with an underscore in the patient acquisition universe. And he's led teams working to drive volume with ROI specific to business and service line priorities. And so a lot of pertinent conversations in today's realm that we can have around that. He worked as the director of marketing and director of consumer engagement at Trinity Health for a while, and at an enterprise, they're an enterprise level health system in the Michigan area, where he helped drive growth and improve engagement and access. And so he also has briefly spent some time working in a digital health and technology company in the product marketing realm. And right now he leads consumer transformation efforts for Innovaccer, which is a company I know a number of our listeners are very familiar with. And I'm eager to learn more about his work there. So Mitch, welcome to Healthcare Market Matrix.
Thank you so much, John. A pleasure to be here.
So, Mitch, tell us a little bit about your journey, how you got from into this realm, because that's, let's face it, this isn't a normal, it's not something that a kid wakes up after college and just says, I really want to jump into the healthcare data universe. What is that meant for you?
Yeah, it's a great question. You're right. It was not a linear path for me, as I'm sure it has not been for many of your listeners and supporters. But as you mentioned, spent most of my career, roughly 14 years, on the hospital health system side at Trinity. And I really started out as a marketing specialist and kind of worked my way up as a manager into a director role, and kind of found my sweet spot professionally in the realm and space of digital marketing, CRM. I became really interested with technology and how things work and how we can really leverage those solutions to better serve our patients and community members. But the last 2 years of my time at Trinity actually was thrust into a role right at the beginning of the pandemic. And I know all your listeners can appreciate this. I had literally the beginning of the pandemic. We had on the heels of an epic go live. And we were the call center that I was going to be supporting had just acquired the 5th hospital. So operationally speaking, it was a lot of complexity, a lot of nuances going on.
A lot of converging factors.
Yes. But it really forced me to learn a lot about the operations side and how operations and technology work together with people. And it kind of heightened my awareness and passion, not just for digital marketing and acquisition, but overall consumer engagement. And so it was, I would say, 2 of the most challenging, but equally, if not more rewarding years of my career, having the opportunity to serve with and support a call center and all the agents, in addition to my work in digital marketing. So transitioning from that, I had an opportunity to take a leap into the dark side, as they say, on the vendor side, where I got even a little more broad as it related to digital health and the technology that supports all of that, and really just kind of recognizing the undeniable momentum that we are continuing to see in the industry. And there's so many opportunities if you're willing to take some risks and take a jump, which is what I did. And that has opened me up to a whole new world of kind of the product side, but really where my passions lie is trying to take everything I've learned from the hospital health system side and now help others across multiple organizations. And that's kind of the role I'm currently sitting at with Innovaccer as their director of consumer transformation.
Yeah, so help us. So lots there, obviously. I'm curious about what are some of the things that you saw, especially in those last couple years, as you talked about that being a particularly impactful time. What are some of the things that you saw clearly emerging with Trinity that help spur your interest, underscore the importance? What were some of those practical factors that you were seeing take shape that made that more front and center in your world?
Yeah, honestly, it was just the challenge of really understanding how technology works from an end user's perspective. So I supported agents, roughly 15 to 20 agents, and a highly nuanced call center that required a lot of different technologies and platforms for them to kind of do their jobs. And it's hard, it's really challenging to maintain overall call performance while also kind of keeping an eye on opportunities to improve technology, improve overall patient and consumer experience. But I think it was really just that challenge of seeing firsthand how end users of products and solutions work and how I can help to make that a better experience for them.
That's great. Give us a little backdrop on Innovaccer. Tell us what the company does for the folks who are not familiar with the organization.
Yeah, so Innovaccer, and I've been here just close to 8 months now, between 7 and 8 months. Company that's very much dedicated to data management for hospitals and health systems, primarily and historically on the value-based care or population health side. But in the last 2 to 3 years, have built out an end-to-end CRM solution and suite of applications specific for healthcare hospitals and health systems. That's kind of where I fit in to the company.
Am I right in thinking a lot of that mission and what they're working toward is the unification of patient records and patient data? Just bringing that all together.
Exactly. And that's really what kind of inspired me, John, to come to Innovaccer, was a company that is truly dedicated at its core in its DNA to getting that piece right, bringing together disparate data sources into one record that can be actionable, that can really help care managers, marketers, all healthcare professionals better serve patients and community members.
Yeah, because so often clinicians are working with partial data sets that are not reflecting the full picture and relying on the patient's ability to fill in those gaps, which we all know, and especially in more acute scenarios, is not an easy thing to do. So getting that information lined out really, really well and consistently is certainly a big part of what I understand the mission of the organization being, and is so important right now, and continues to be a challenge that the whole interoperability equation is working to help master at some level. So knowing your backdrop and I'm fascinated with the whole move and some of the dynamics that are involved right now in the move toward the understanding of needing to, for traditional health systems to look at the people that they serve as consumers and what that is, means, and looks like. What does it take for a healthcare organization to, what do they need to be from a cultural perspective to impact that kind of transformation or that kind of movement? What are some of the things that really need to be in place?
I mean, change management is such a key piece to that, John. I think there's inevitably a lot of operational and otherwise disjointedness as we continue to move towards this notion of systemness. And I think there's varying levels of how that is happening right now across the industry. But that ultimately creates an environment where folks feel comfortable coming together. And I use the word comfortable because I think that's really important. It requires sometimes a lot of uncomfortable conversations when you've got people in marketing versus finance versus operations versus clinical informatics talking together, speaking different languages, having been historically kind of siloed in their areas for a number of reasons. You talked about, data, disparate data sources is a big part of that. Using different technologies, leveraging different data sources has kind of created some of that disjointedness. So I think to answer your question, that's really where it starts, is trying to find ways to come together and to just start talking. We all have common goals. How do we work on that together?
Yeah, and it's never easy for an organization to confront a gap, right? I mean, that's all, because it's pin the tail on the gap is the is the game that a lot of people end up playing in those scenarios, and you can't afford to do that, especially when the call is as urgent as it is right now, with health systems needing to very quickly and effectively address the consumer opportunities that exist as in their organizations. So what I know, and we talk about, anytime we're going to talk about consumer engagement, the conversation very quickly turns to technology, because we're talking about communication of a lot of things to a lot of people. It's not something that that we can't build call centers and staff call centers that big, and let alone afford it. It has to involve automation, and it has to involve a robust tech stack. What were some of the things that you were employing in the context of Trinity, and to what end, and what did that look like?
Yeah, so CRM was a big part. So, our customer relationship management platform and solution was used, primarily for a lot of patient acquisition campaigns and strategies, but it also kind of spilled into the contact center or call center as kind of that conduit, a way to kind of bridge the gap in between marketing and the call center. So that was a big piece of what I worked on. Also, of course, the ecosystem and tech stack associated with the call center in terms of a telephony platform, agent councils. A lot of that I learned, but ultimately allows agents and customer care reps to serve patients and community members. Those are kind of the two biggest pieces of technologies or platforms that I was involved with. And the challenge, having kind of come from the marketing world into operations and into the call center, was how to bridge the gap between those two worlds, to help not only manage daily call volume for your basic call needs, but also to help at a more sophisticated level engage with community members specific to campaigns and other initiatives.
And so what were some of the conversations and some of the technology that was beginning to get a foothold? What were some of the innovations that you all were looking at in that realm?
Yeah, so we were really trying to, one of the areas that's still a nut that I'm trying to crack, and I think a lot of your listeners probably are to an extent, is the kind of not only bridging the gap between call centers and marketing, but in the clinical space, finding ways to seamlessly transition folks to a nurse navigator, for example. If there's an initiative around, lung cancer, how do you empower an agent or a customer care rep to guide somebody through a conversation that has concerns for lung cancer, sticking with that as an example, as far as you can go until they may potentially qualify for different services. How do you operationalize a way to get them connected to that navigator, to that clinical member of your organization to help them get the services they need, which, in other industries probably seems really simple. But in healthcare, as you know, and as many of your listeners know, that's really, really difficult. But it's something we've got to figure out. And that's an area, to answer your question, where we were moving towards what felt like a very innovative thing from a process perspective and a workflow perspective, but transparently, we didn't quite get there. And that's an area that I think we're all continuing to work towards.
Gotcha. So knowing that, so that you were looking at those elements and staring at some of that horizon, what were some of the factors that led you to the move to Innovaccer? What did you see as compelling on that side of the equation that you wanted to help make happen?
Yeah, I'll kind of go back to one of our founders, Kanav, who's our chief product officer, and he talks about, and does it much better than I do, but rediscovering the joy of medicine. And I think about that a lot. It's a kind of a rallying cry for us at Innovaccer and what we really try to do for customers. And that resonates with me quite a bit, having spent the majority of my career on that side, because as we all know, the pandemic took its toll on not just providers and physicians and clinicians, but healthcare professionals as a whole. The agents that I served with in the call center, things got really hard and are continuing to be difficult. But I feel like we are at this point now where the technology's at a place, there's so much focus on consumer engagement that we're starting to see some movement that's helping not only create better experiences for our patients and our community members, but again, helping people rediscover the joy. Because you don't work in healthcare for giggles. You do it because you love what you do and you kind of embrace the chaos. But that's what motivates me.
Or at least tolerate it.
Right. Right. But every now and then you see examples of where people are starting to kind of rediscover that joy, and that keeps me going. If I can help our customers do that, that fills my bucket every day.
Yeah, absolutely. So how is Innovaccer approaching making that inroad? What does it look like marketing in the health systems? What are some of the things and some of the messages and ideas that you guys are pulling forward in and around this engagement realm and the consumer realm? How are you having that conversation?
Yeah, I mean, we it's not like a broken record, but I think it's important that it goes back to data. Knowing we put so much emphasis on getting that part right, as you mentioned and articulated well at the beginning, bringing together different data sources into one record to allow our customers to take action. And that is a real differentiator for us, and where historically, marketers and other professionals in healthcare have kind of looked at data as this black box where you don't know what you don't know, where we like to think we've created an approach and a practice to data management where that becomes fully transparent and allows customers to understand their own data in a meaningful way, so that it's not always going to answer all the questions, but it'll help you ask the right give you all the answers, but it'll help you ask the right questions.
No doubt. As you guys are looking at engaging with those organizations from the Innovaccer side, and kind of combining that with some of your direct experience on the provider side, what are some of the obstacles you've experienced in integrating new technologies, new platforms that end up causing challenges, or what are some of the things that you would want organizations to know coming into a health system, and how are you helping Innovaccer ease that process?
Yeah, that's a great question. And honestly, I'll I think it's always good to celebrate success, but also learn from failures. And one of my, not personal failures, but when I at Trinity, we recognized pretty quickly that we had a missed opportunity as it related to integrating the technology that was used to support agents with some of those marketing initiatives, that we didn't have our end users, our agents, our customer care reps really at the table from the onset to help understand and have that
the actual anatomy of things.
Yep.
Yeah.
Exactly.
What's actually happening on the ground.
Right. And I think that's a really common missed step. And going back to the idea of the joy of medicine, it's hard to find joy in your work when the tools you have don't work the way they're supposed to work or the way that you need them to work. So that's one aspect, I think, is making sure your end users are at the table from the onset, have them involved as much as you can possibly have them involved. Number one, to create some ownership, but also to get the product where it needs to be. So that's one piece, and we certainly practice that or encourage that with our customers at Innovaccer as we go through implementation. But the other piece too, John, is really understanding the tech stack and ecosystem, and being able to visualize what that looks like. So, and as you know, listeners know as well, like that's really complicated. If you were to put it on a whiteboard, it looks like a kind of a mess. But understand what that mess is and where this new piece of technology fits in and how it actually integrates. And a very specific story I can think of, hearkening back to the Trinity days when we had the call center, we recognized that the console the agents were using wasn't integrated with the new solution. So we had to create a middleware, which is like a Band-Aid solution to fix that. I know that's a very specific example,
but that's not an uncommon one.
Not an uncommon one.
Happens.
Yeah. So,
yeah,
those are the two things I would think of.
Yeah, great points. When you look at the process of, what I know is part of what Innovaccer is enabling is better, cleaner patient data.
Yep.
And how do you and data, clean data is certainly an important part when we're looking at segmenting and understanding who it is that we're talking to and working to engage. How do you see segmentation and how does this delineation evolve based on the specific target markets that you're concentrating on?
Yeah, so I kind of go back to Trinity first, because a lot of those principles apply to what we do at Innovaccer within CRM and the customers that we work with. So there are a number of ways. The most common in terms of developing a delineation between those types is using different like clinical propensity models. So taking your existing data and using propensity models to understand people that are most likely in need of knee surgery or maybe in need of weight loss options. And not always perfect, but it helps you kind of go after the unknown, so to speak, the folks within your primary, secondary service areas that may be raising their hand in need of services. It helps you kind of understand who they are and how to kind of target them accordingly. So that's one way to kind of delineate between those groups. And within those groups, of course, you've got folks that are actively engaged for me. So those are kind of at the high level, how we kind of group up those two personas. Who I deal with and who we deal with most commonly, I'd say would be the influencers. So the folks that are going to be either using the technology or managing the teams that use the technology, because we want to make sure it's a good fit, that our solutions, our applications, our approach kind of aligns with their thought process, but also will ultimately work with their teams on a day-to-day basis.
Yeah, in my experience, the influencers are often the black sheep. They're not necessarily folks that people are spending a whole lot of time, effort, and energy in treating, and I see that as a pretty consistent mistake. Talk a little bit about how you differentiate there and
Yeah.
what types of things you're doing to engage in the context of the influencer space as opposed to the more traditional buyer.
Yeah, I like that.
Personas.
That's a really good term, the black sheep. That very much kind of fits that persona. But our approach,
or at least the forgotten sheep.
the forgotten sheep. Yeah, exactly. Honestly, I think a big part of it is knowing that these are not the buyers per se, helping them have a voice, because inevitably these are a lot of folks that are very passionate about the work they do, sometimes obsessive in a good way.
Yep.
You look at any healthcare organization that has a successful marketing team, whatever that function is, it always stems from somebody that has that kind of unwavering commitment and obsession. So finding ways, rather than selling to them, give them a voice. Doing what you're doing, providing this amazing platform for people to talk about what gets them excited. Because number one, you're going to learn a lot. Approaching that with curiosity helps you individually, and in turn helps them feel better about the work that they do. And if you have solutions and services that could serve them, then you're empowering them to have those conversations internally. Nothing's more powerful than that. It needs to come from internal folks within their stakeholders.
I really couldn't agree more. And it really, to me, is becoming an increasingly important framework, because what I know is, we interview a number of CIOs on healthcare market matrix because they're one of the primary buyers, right? And none of them have got time. None of them do. None of them sit around going, wonder what I should consider today. Their list is long. The competition for their time is fierce, and who they decide, especially from an outside perspective, who they decide to listen to is really, really carefully relegated. And what I also know, because I would say that this is very common in the CIO role from my experience also, is the people that have that position are usually extremely empathetic and very tuned in to the people that report under them, because they're all in this pretty difficult challenge together. And I've been really impressed across the board with the folks that we've talked to about how well tuned they are to the anatomy and the challenges of their organizations. So it just makes sense to spend some time cultivating relationships and equipping the influencers to tell your story extremely well. Because if you can do that, if you can help them become your advocate in a world where you've got a CIO who truly is desiring to figure this equation out and meet the needs of an organization, that voice is the best voice if it's coming from a sincere direct report who has found something that they're passionate about and can tell a story that is meeting one of their needs. Boy, that seems like a really well positioned opportunity.
Yeah, I agree. And I think too, it just to kind of add on to that, it shows, at the CIO chief level, C-suite level, somebody that's willing to spend time like that, I think with their team means a lot. They see the benefit and value in doing that, not only to give them a voice, but to learn from them. And it just creates more of that relationship as you evolve from just a transactional type engagement. So
yeah,
it makes
no
sense.
doubt. So What I know is that right now, to foster stronger patient relationships, the healthcare industry is really shifting away from what we're talking about. I mean, the traditional engagement methods. We're not seeing the kind of billboards we used to see. Billboards are no longer a primary strategy of healthcare systems, and if they are, we have a problem. So putting greater emphasis on proactive engagement strategies. So let's talk about how to measure success there and what you've seen. How would you recommend that healthcare technology companies think about messaging these types of strategies and the system to the systems they partner with? And we'll start with acquisition. What does that look like?
Yeah, I mean, it's you mentioned, kind of evolving from billboards, and we still see billboards, which is crazy.
No, there still are billboards.
They are
and
still there.
How many minutes do you have to wait in the ER? Those still exist in our little community.
Yes. So it is a challenge, but within acquisition, I think, and your point is well stated. How do we get past or get more proactive? So using data, we've got, as mentioned, access to so much data, but how do we take some of the key pieces of that data to help understand what that next, we talk about next best action. That's a term used quite a bit, but I think it lends itself to acquisition well because it's anticipating what the next need could be, whether that's in the conversation with an agent in a call center or for campaigns and different communication tactics that are designed to help understand what that might be. So it's really showing what that next best action could be and helping community members take action on that. So that comes to mind right away as it relates to acquisition. And then, other areas too, more kind of in the population health element, but, how do we reduce ED admissions and recognizing cohorts of patients within your hospital or health system that may be have a propensity towards that, and acting accordingly.
How about in the context of retention? When we're looking toward identity-based engagement, and how can healthcare technology companies, how should they be thinking about designing data to help accelerate retention strategies for healthcare companies?
I always start with show me that you know me, and it's so hard to get to that level of one-to-one personalization, but we have to keep moving in that direction. And the data is there to do that, but the challenge is surfacing and serving up elements of that data that will help empower our customers to demonstrate that. Very quickly, we talk about, the most common is somebody that's due for an annual well visit. Looks like you are, it's been over a couple of years. Would you like me to help you get that scheduled for you? Again, sounds very simple in other industries. That is a challenge in healthcare, but a very, feasible way to show folks that you know them, create that one-to-one personalization, and ultimately retain your patients. So I think it's really that piece of personalization.
Yeah, that makes sense, and is going to be an increasingly critical component and expected component as some of the bigs continue to enter the space with gusto, and they already know a whole lot about us.
Exactly.
That feels like they're living with us. That's because they kind of are. They know what's in our houses. They know what our buying habits are, and that's a lot of powerful data.
We used to say, and you'll probably appreciate this, it's kind of along those lines, with that mindset, reminding our customers, our marketers, that we're not selling shoes. So we have to use the principles, the technologies in the context of healthcare. So don't be creepy, just show me that you know me.
Yep, that's a good. How about in context of leakage? How should solution providers be regarding that?
Yeah, claims data is a big piece to that. I think that will help identify where there is existing leakage, so that you can act accordingly. That can be a scary thing for a lot of folks. It was for me, just because there are so many different clearinghouses and companies that are
Selling that data.
housing and selling it, and it's
Yeah,
rich data. But what do you do with that? But there are I'm seeing a lot of emerging solutions, dashboards that are taking that data, making it visual, making it actionable, so that you
sure.
can clearly see where that leakage is occurring, and start asking some of those important questions.
Yeah, that's good. How talk to us? There's clearly data is one of the most powerful assets that a healthcare system has in its possession, and how it leverages that is really critical. And I think that as a vendor, showing that you understand that and are a good steward of that um, is really important. But what strategy or initiatives um, do you see being front and center around that uh, when we're talking about how we're improving customer uh, relationships and engagement? What are some of the things that we are looking at as a whole organization around treating data as a strategic asset?
Yeah, I mean, you gotta lead with data. And again, a lot of the folks and customers that I work with are in the marketing consumer engagement space, and historically that's been lacking from the story. But
Mm-hmm.
but starting with data creates a level of objectivity that kind of takes the emotion out. And there's so much emotion um, in healthcare, especially kind of going back to our earlier points around this movement towards systemness. But we're kind of limping towards systemness, and through that there's some challenges, and there's a lot of feelings and a lot of emotions. But data kind of takes that away and allows us to work on a common platform and a common playing field, because it's hard to argue with data. But it's also important to know that it's not always going to give you all the answers. It's going to help you ask the right questions, right?
Mm-hmm.
So those are some of the pieces, John, that we work on with, and it is so important. I think this is a great topic around developing a practice around the technology. It's not just about the technology, but how do you really develop a practice and empower customers to articulate the value through data, keeping data at the forefront of those conversations. And honestly, data's fun. I'm not even a data guy per se. I'm not a data scientist. But when you find ways to use data to kind of tell your story and to validate what you do, it's going back to that idea of rediscovering the joy of medicine. It creates joy. It's a fun thing when you learn how
Yeah.
to use it the right way.
It's one of the things that I just am always puzzled at. And I'm sure that from my naive perspective, that I am missing a big part of the complexities associated with this. But we work with a number of platform companies, and I've been exposed to a number of platform companies that have un, just amazing access to amazing troves of powerful data around different engagement patterns, around different identified things that could be really meaningful. And it's been interesting to me to look at how many technology companies put their solution forward, and their solution it has just all this phenomenal perspective and insight around data, opportunities around data, and they are not planning to leverage that intelligently. They're like, I look at these organizations and what they have to do, the opportunities they have across their client base to identify benchmarking, to identify, trend analysis. It doesn't have to be identified data. It's just trend analysis, and what kind of level of insight that could provide their customers if they could say, hey, across our platform, here are things that we're seeing that are going to be clear indicators of XYZ, and they don't have that as a prioritization in their, and I just look at it and go, what an incredible value potential.
Sure.
But they just let it sit there in the process of, and I, like I said, I'm sure that I have a very naive perspective on what that takes to do, but it sure seems like if you stuck a data scientist on it, they could come up with a very compelling product addition that could provide great value to their customers.
Oh, for sure.
That wouldn't mess up anybody's compliance agreements.
Yep, agreed. And it's just, and also it's a good point of how we need to be more transparent and for the greater good, right? There's that opportunity as well. Like, of course, we all have business goals and objectives and needs that are unique to our areas of work, but there's also a greater good that I think we can all focus on. I think that's kind of what you're hitting on. There's ways that we can achieve both.
Yes, no doubt about it. So let's pull back a little bit. If you could share, because you've looked at life from both sides now, if you could share with a health tech company a piece of advice, knowing that you've sat on both sides and knowing that you've experienced some of the wins and the shortfalls with some of the organizations that you've worked with, what's a piece of advice that you would put forward that might be helpful to marketing, company marketing solutions into the healthcare space?
Yeah, I think a lot of it is trying to solve real problems, and rather than making
that would go into the obvious fundamentals that are so often ignored.
It's so true. But I think that the challenge of solving real problems is it takes a certain level of, I don't know if it's vulnerability or curiosity, humility, right, to understand what those, and they could be super small, they could be very specific things, but if your ability to either solve problems or work towards solving those problems goes a long way in developing trust and rapport in the spirit of a true partnership. So that'd be my recommendation, is trying to find those real problems.
Yeah, it's such a phenomenal thing to watch happen. We have a process that we work through with our clients where we're working to unearth the real problems that people in their market are facing. And we do it through a workshop process with their stakeholders and sometimes some outside experts coming in and just, and we list problems faced that are in any way related to their product directly or their offering. And we just put up the primary problems that real people in the real world are really facing every day. And we list those out and we put them in priority order. And priority is determined by urgency combined with willingness to pay to solve. Because at the end of the day, those are pretty important factors.
Sure.
And it's amazing to me, Mitch, how often that is a incredibly revelatory conversation. What we see is they'll confront that problem list and they'll look at the top 2 or 3 problems and say, so help me understand why we only have a 50% solution for that. And we're down here on problem number 9, 10, and 11, spending a bunch of development cycles solving for these problems that are pretty far down the list when we could reallocate those efforts to creating 100% solution for a number 1, 2, and 3 problem. And it's just because they're looking at what the technology can do,
Sure,
as opposed to what the market actually needs and will pay for. And it's an easy thing when you're focused on technology solving problems to run after the problem that avails itself after the last conversation you had with a leader, or something like that. And, and it becomes a priority, even though that leader of that particular health system that you happen to be talking to has a little bit of an esoteric problem that, yes, you can solve, but it's it's not going to be a market mover.
Yep.
And so doing the work of really, like you said, Mitch, just doing the work of really understanding what the real problems are is critical. And we continue to hear from a number of folks on the buyer side that you've got to do that work. You've got to get into their world and understand what's really going on in their particular scenario and speak to that.
Yes.
Be informed and speak to that directly. Don't just come in with your blanket and expect to cover their feet with it. You may not be able to.
Yep. That's right.
It's a tricky scenario for sure.
It's a great example.
When putting your provider hat back on again.
Sure.
When you were in that seat, where were you learning about new innovations? What were some of the channels that you were living in and that were effectively reaching you?
Yeah, and I'm sure I wasn't alone in this regard, but traveling budgets are very thin if they exist at all. Yeah. So when I could, I would say my top 3 conferences: HCIC, which is Healthcare Internet Conference; SHSMD, I think most listeners are familiar with that, and then HMPS are the 3 top marketing, technology, consumer-focused conferences. But so I would glean a lot either from going or getting access to sessions. And then aside from that, just a lot of podcasts. I love podcasts. I love learning. So, being active on LinkedIn, understanding where there's content to glean from and other thought leaders to learn from. So that's our two biggest areas, I'd say, for me.
Yeah. So going the other direction, what things annoyed you? What were things that you were seeing happen that you're just going, oh, come on? What were some of your pet peeves?
Gosh, I think it's more, I guess it kind of goes back to, and I loved your example of how you really surface up real problems and spending time to develop relationships. The opposite of that is, cold calls or cold emails or cold messages on LinkedIn when somebody doesn't know you, but they're pushing a product. And it just doesn't work. It doesn't work. And it's kind of shocking that it still happens more than it should. So to me, that's the biggest annoying thing.
Yeah, I hear that pretty frequently.
Yeah.
It is, as I mentioned, I mean, you gotta show up and you gotta know and have done your work. I think that it keeps being increasingly underscored and stuff I'm aware of that, those more account-based movements and how we get information about a particular health system that we can then figure out how to create campaigns around that would target specific needs and be relevant.
Yep.
Seems really increasingly important.
Agreed.
Well, that's some great points there. What is on Innovaccer's front burner right now? What are some of the things that you are involved with that are that you're excited about and bringing forward that we can be looking for?
Yeah, well, I mean, the big focus for me, CRM, as I mentioned, is still one of our newer products and offerings, but having a chance to really understand it deeply from a product perspective, I'm so excited about, bringing this, continuing to bring this into market as it continues to mature, helping other marketers and healthcare professionals understand the benefit of a CRM within a data company that historically is rooted in value-based care and population health management. It's a really unique blend of those worlds. So I think that's really at the forefront for me, John, is just continuing to find our existing customers, help them find success, but also introduce these solutions to others as well, where there's a fit.
That's awesome. Yeah. And it all comes, at the end of the day, all these things are determined to help make the lives of providers, the folks who are on the front lines making things happen, be able to do their jobs better and more effectively because they have, they're working with the right people and the right audiences and the right understanding of who they are.
Exactly.
And that ends up being such a critical component. So just winding up here, first of all, I'd just like to say, Mitch, thank you for joining us today and offering your perspectives on this. Just want to make a blanket invitation to our audience. Any feedback, topic suggestions, ideas you have bouncing off of this for future episodes? That's actually how Mitch found us. He had some feedback or some thoughts he wanted to offer, and we started a conversation. But that would be great. Mitch, where can our listeners follow you and understand more about what's going on with you?
Yeah, and again, thank you for having me on. This has been a pleasure. And folks can find me on LinkedIn, very active. I am on Twitter, or X, as they say now, at MCH110. Feels weird.
As they reluctantly say.
I don't know if I can do it. But admittedly, I would say the Twitter X space is my half and half of work and my personal endeavors and sports and other things. So fair warning there. LinkedIn, I'm all in on work stuff, but I really, really love interacting. So please reach out. I love having conversations, learning from others. That's the best way for me to grow and hopefully to help others do the same. So,
well, and Mitch, I'll just say too, I really appreciate you setting aside your football allegiance to spend some time as a fan of the maize and gold, talking to a fan of the scarlet and gray. One of the great rivalries, but you handled it really well, and I appreciate that.
See, we can get along, John. Who knew? Who knew? Wolverines and Buckeyes can get along. There's that.
We're all people.
That's right.
That's right. Well, thanks a lot, Mitch. Appreciate you joining us here today on Healthcare Market Matrix.
My pleasure. Thanks, John.